Crohn's disease is a transmural inflammatory process of the bowel which leads to obstructive symptoms and fibrosis. Any part of the GI tract, mouth to anus, is at risk of developing this, but the most common place is the right colon and terminal ileum. It can affect anyone at any age, but the most common age group is 15 to 35. There's no known cause, but there's many contributing factors, such as environmental factors, such as smoking, having parents who both have Crohn's disease increases the chances of developing it. Infections, psychosocial and psychological stressors can also lead to exacerbation. Research on genetics and immunologic factors continue to evolve every day. It's been found that mutations that are within the NOD2 gene, also known as the IBD1 or CRD15 gene, are also shown to confer susceptibility to Crohn's disease. The NOD2 gene is found on chromosome 16, which regulates the intracellular immune response to bacterial products. The ILR2 gene also has an increased susceptibility of developing Crohn's. A couple infections that are also kind of predisposing to developing Crohn's disease are Listeria, Pseudomonas, or Mycobacterium paratuberculosis. So how does Crohn's affect the body? Crohn's affects the entire thickness of the bowel wall and the layers of the submucosa. The mucosa is chronically inflamed and contains a high number of T cells, immunoglobulins, and macrophages. The T cells attract nonspecific inflammatory cells, especially neutrophils, which play a role in tissue damage. The response produces cytokines, growth factors, antibodies, and proteases, which all contribute to continual tissue destruction. The lesions that are visible are edematous, purple, and a reddish color areas in a segmental pattern. Skip lesions are present, which are areas of disease separated by healthy tissue and diseased tissue. The lymph nodes in the submucosa are enlarged with small superficial ulcerations and deep fissures that penetrate the bowel and lead to abscesses and fistulas. Anal fissures are also common due to the chronic diarrhea. Crypt tissues are also composed of morphonuclear leukocytes, lymphocytes, red blood cells, and cellular debris. Cobblestoning can appear, which are granulomas that are developed in the bowel mucosa. Secondary infections occur, which can lead to scarring in the fibrotic tissues, along with narrowing of the lumen, thickening of the bowel wall, and shortening of the colon. Extreme dilation of a portion of the diseased colon causes complete obstruction and impaired absorption of electrolytes and fluids. It's called toxic megacolon. It can result in life-threatening perforation and peritonitis.
Crohn's disease can be a little tricky to identify. A typical presentation of Crohn's disease will include either remissions or exacerbations, and it will have a patient complaining of severe diarrhea as well as abdominal pain or discomfort. The clinician should look for GI upset such as blood in the stools, number of stools per day, types of stools, as well as any type of aggravation or alleviating factors that could have caused these. It's also important to note that malabsorption and nutritional deficiencies are prominent signs for Crohn's disease, so lack of absorption of fats, folic acid, iron, vitamin deficiency can all occur, as well as possible anemia and dehydration because of the loss of blood or fluid from the stools. It's also good to note that the clinician should be observant if the patient is on laxatives, takes antibiotics, or has any dietary intake of any food supplements or replacements, because they can also cause factors for Crohn's disease as well as additional emotional stress.
Signs and symptoms of Crohn's disease may include abdominal pain or tenderness, increased bowel sounds, steady weight loss, nausea, vomiting, diarrhea, paleness or pallor. In acute exacerbations, it may also lead to fever. Besides intestinal symptoms, Crohn's disease can also cause arthritis, inflammation in other parts of the body, and dermatological problems. Diagnosis of Crohn's disease can be a little bit tricky because it is very similar to ulcerative colitis. The distinguishing factors of Crohn's disease compared to ulcerative colitis can be seen in a colonoscopy to differentiate the disorders. Cobblestoning can be seen in examination of the colon. There will be anal fistula and anal fissure formation. It can affect any part of the GI tract from the mouth to the anus. It can also affect the GI tract with skip lesions. Healthy tissue is interrupted by areas of diseased tissue, and it will affect the whole thickness of the intestinal wall. Another differentiation between ulcerative colitis and Crohn's disease is that Crohn's disease does not characteristically predispose to cancer.
So I want to ask if the disease is curable and what medications can help with chronic disease.
So there is currently the disease is not curable, but there are medications that can help with inflammation and with the disease process. So we usually use two different treatment strategies, which is step up and top down therapy. So we start with step up therapy, and we usually use the drug mesalamine, which belongs to aminosalicylates because it has less side effects. If it's ineffective, we'll try the top-down therapy, and we'll try biological therapy and drug infliximab or immunomodulator therapy with methotrexate and see if it helps. If it's still ineffective, we'll try glucocorticoids, which is prednisone.
What about diet?
So patients are advised to consume adequate fluids, to eat 5 to 6 meals a day, to avoid high-fat food, also to have a balanced diet and consume enough vitamins, especially calcium and vitamin D. And also we advise to avoid alcohol, strong tea, and coffee.
Will I have a surgery?
So if medications, lifestyle changes, diet, or other treatments won't help, the doctor might recommend the surgery. Some people have multiple surgeries, but every attempt is at conserving the bowel is made in surgical approach to Crohn's disease. However, repeated intestinal resection is common, and it can cause complications.
Can you tell me more about complications associated with that disease?
Yes, so one of the complications is a small bowel obstruction, which is a blockage in your intestines. Also, the obstruction can result from improper healing, and it also can be undigested food that can become impacted, or adhesions, which is a scar tissue that is formed between two structures or organs where they're not supposed to be connected, and it happens sometimes after surgeries. Patients are also at risk for developing blood clots, which can travel to your lungs and cause what we call pulmonary embolism, which is very serious. So the doctor might prescribe you heparin, which is a blood thinner, and it will help to prevent those blood clots. Also, if the patient, if you start taking glucocorticoids, you're at risk for osteoporosis, which is a weakness of the bones. Also, the patients with this disease are at risk for anemia, which is low red blood cells, and skin cancer. So we suggest the patients to be periodically screened for these disorders. It's also recommended to keep up with all your vaccinations and get a flu vaccine every year. Okay. Do you have any more questions for me?
No, I'm good. Thank you.
Okay, thank you so much.